All right. Yes.
Perfect. Yes.
So I'll be ready to go wherever you want.
Okay, I'll just do a brief introduction and then you're good to go. Good afternoon, everyone. My name is Benilton Carvalho. We are here today with the 12th round of the ABE e COVID-19 Ações e Desafios. Today we have the great pleasure to receive Francesca Dominici. Francesca is professor of biostatistics at Harvard at the School of Public Health and the co-director of the Data Science Initiative at Harvard University. Francesca, thank you very much for accepting our invitation. You're good to go whenever you're ready.
Great. So here we go. I am gonna put the full slide. Great. So thank you so much for inviting me. It's really my pleasure to tell you some of the recent research of me and my colleagues on air pollution raised COVID-19, and with a focus on data science. I wear a double hat in terms of both professor of biostatistics at the Harvard THM School of Public Health and also one of the two directors of the Harvard Data Science Initiative. My goal is to not to speak for the full hour, but to speak maybe for 30, 40 minutes, and then make sure I can leave time for questions. So let me start with the type of research question I will be talking to you about. So first of all, the first question is whether there is evidence of a causal link between long-term exposure to air pollution and mortality, even at levels below the National Ambient Air Quality Standard in the United States. The National Ambient Air Quality Standards are levels of air pollution below which we believe that it's safe. This was a major study of over 550 million observation. The second question is, it's pretty clear, and it's fortunate that, especially in the United States, but also in other parts around the world, that the air is cleaner today than 20 years ago. But the question is how we're making progress in eliminating environmental injustice. As you probably are very much aware that sometime when we are implementing air quality regulation, we are not doing in a way that everyone benefits in the same way. Then specifically to COVID is, does long-term exposure to air pollution increases the mortality rate for COVID-19? And finally, clearly everything that we do is about data science. And so even though we are trying to make progress on this research question, there are really unresolved data science challenges that we are facing. So I think that when we published as a preprint and we provide the first analysis that provide preliminary evidence of the link between long-term exposure to PM2.5 and COVID-19, that had a tremendous amount of attention from the press. This is an article of the New York Times. And the reason why this was so important is that at the time where we are all being affected by a pandemic that is affecting our lungs, we have the Environmental Protection Agency in the United States is actually deciding not to lower the National Ambient Air Quality Standard for fine particulate matter. And so Mr. Wheeler, which is the administrator of the Environmental Protection Agency in the United States, said that they thought that through this 5 years review process, they have identified uncertainty. They're unsure whether fine particulate matter is bad for you. And so they have decided not to lower the National Ambient Air Quality Standard, which is really pretty inconceivable. So the question that we were focusing is exposure to fine particulate matter below the National Ambient Air Quality Standard associated with an increased risk of mortality, and then are some population at higher risk than others. The data that we have are, it's really comprehensive because, so although in the United States we don't have a national health insurance, everyone in the United States is kind of covered for the health service by Medicare. So we have a population of 67 million, which is over 67 million, which is basically good 97% of the population of elderly in the United States. These are individual level data, and they are followed over time from the year 2000 to 2016. We are using as outcome, we have all-cause mortality, we have the individual date of death, and also we have cause-specific hospitalization. We have individual level information, like, as I said, that date of death, age of entry, so when they become eligible to be covered by Medicare, the year of entry, sex, race, and also whether they're eligible for Medicaid. In the United States, if you are also eligible for Medicaid, it basically means that it's a proxy for low socioeconomic status. And then we have a very extensive set of zip code level variables that tell you socioeconomic status. And zip code is basically the area code in the United States. So most of my work, I have to say, has been relying, to me, I always say there is not data science without data. Actually, I say there is not science without data science, and there is not data science without data. And so we have been investing a tremendous amount of time, resources, in putting together a very comprehensive research data platform that provide all possible information on what are the exposure to environmental factors. So not only exposure to air pollution, but also exposure to greenhouse gases, weather, emission from power plants. And then we have health outcome. I mentioned Medicare and Medicaid. And then we have several potential confounders, which are all of the variables that can potentially confound the association. Oops, let me see. The association between exposure to air pollution and health. So in 2017, we published this very impactful study in the New England Journal of Medicine, where we analyzed this complete research data platform to look at whether there was a relationship between historical exposure to fine particulate matter and mortality. The photo here is the photo Chandi, who is at that time a PhD student and who led the study. And I think there were two important messages. This was analysis that was done using pretty much standard regression approaches. We're using a Cox proportionalizer model. And what was important, though, just to have a general picture, is that the horizontal line, when he said overall population, is basically saying that for 10 microgram per cubic meter in fine particulate matter, we have a 7.3% increase in all-cause mortality. And that fact is a statistical significance. So this horizontal line is centered at 1.07, which is the estimates of the hazard ratio. The other thing which was really important, is that we found that when we conduct the analysis separately for different subgroups of the population, you see that the Black Americans have a mortality risk associated with fine particulate matter that was 3 times higher than the overall population. We also have that male have higher risk, Native American, although not statistically significant, tend to have a higher risk. Hispanic and Asian have higher risk, and also the people that were also eligible for Medicaid in addition to Medicare, they had higher risk. So this had a lot of attention because it was the most comprehensive from the press and from the politician, because it was the most comprehensive study today for all the United States, really underlying the fact that exposure to fine particulate matter increases mortality risk, even at a level below the National Ambient Air Quality Standard. Unfortunately, under the EPA Trump, there's been a strong interest into stopping regulation, even though you have strong statistical evidence. And this is just a paragraph that was extracted by an industry consultant who was unfortunately now the chair of the Clean Air Advisory Board of the EPA. And basically the general argument was you cannot use standard regression approaches to inform regulatory policy because you cannot assess from standard regression approaches evidence of causality. And so there was this strong criticism in saying all of the epidemiological study and generally any type of statistical approaches that doesn't allow you to extract cause and effect from observational data, then you cannot use it to inform regulatory policy. Of course, as you all know, you cannot perfectly assess causality in observational data. Confounding is always a possibility, but that opened the window for us and for many others to think about methods for causal inference when we were trying to assess this relationship. So we had the second paper, which is in Science, that was published in last June 2020. So the New England Journal of Medicine used standard regression approaches, and it was published in July 2017. We had this paper coming up 3 years later. The lead author is Zhao, who is a PhD student in the department and co-led with Danielle Brown, who is a research scientist in the department. And basically what we did the entire analysis, but instead of using standard regression approaches, we use method for causal inference. And by method for causal inference, and again, the paper goes in the excruciating level of details, but basically for people that are, if people wanted to learn about how you do causal inference using observational data, I think this could be a good paper to read. Also, we share the code. And the idea basically is instead of adjusting for confounding using linear term in the regression model, we adjust for confounding by estimating a generalized propensity score using machine learning approaches. And then either stratifying by the generalized propensity score, weighting by the generalized propensity score, or adjusting by the generalized propensity score. So we had this updated analysis. Also, we updated the data up to the year 2016. So these maps on top is the level of fine particulate matter in the year 2000, 2016. You can see that clearly the level of fine particulate matter have declined. The data was massive, is 68 million individual. We have more than 38 million that were exposed at level below the fine particulate matter, below 12 microgram per cubic meter. We have 27 million deaths and 573 million observation. And so we reanalyzed the data, as I said, not only using standard approaches, but using 3 methods for causal inference. And so both using matching by generalized propensity score, weighting by the propensity score, and adjustment by propensity score. And so we're using a gradient boosting machine to estimate the generalized propensity score. What was important is if you look on the picture on the left, this is basically the estimation of the estimated odds ratio, considering the entire exposure range. And you can see that the first two were how we estimate the odds ratio by using standard regression approaches, both using a Cox model on individual level time to that, and also Poisson on aggregate counts. And then we had these 3 approaches where we reanalyze the same data using causal inference method, and you see that they're pretty similar. And then very importantly, we also reanalyze the data only for the people that were exposed a level below 12 microgram per cubic meter. And so actually we see that not only there is evidence of increased mortality risk a level below 12 microgram per cubic meter, but this increased risk are even higher. If we did find that the methods for causal inference tend to have estimates of the odds ratio that were lower than the standard regression approaches, but clearly these are all effects that were highly statistically significant. One thing that is really important to consider, and why doing causal inference compared to regression approaches, is they give you a sense of the degree to which your measured confounders are properly balanced between exposed group and unexposed group. In the context of a continuous exposure, a measure of covariate balance, which is basically telling you how closer you are to have been properly accounted for confounding, is measured by these quantities called the absolute correlation. And so just to give you an example, so in this plot, basically what you have here is these are all of the potential measured confounders. These are, the red is basically the level of correlation of these measured confounders with PM2.5 if you don't do any adjustment. And so if the correlation is higher, it means that you could have, you know, bias inference, bias conclusion. And then the green are the levels of absolute correlation between the potential confounders and the PM2.5 after we have implemented our methods for causal inference. And you can see that is all below 0.1. So again, it's you know, because they are so low, it really means that we have redesigned the study such that by matching with values of the propensity score, we have achieved good adjustment for confounding. And this is the same plot, but only for people that were exposed below 12 microgram per cubic meter, just to make sure that also the inference in that sample, you know, is not affected by measured confounding bias. Now, the other huge issue in the United States right now is at the intersection of COVID and environmental justice, actually environmental injustice. Has been reported consistently that Black Americans are suffering disproportionately from air pollution and the coronavirus death. And a paper that we posted on a preprint and is under peer review is a paper led by a former postdoctoral fellow. We all call him AJ because it's impossible to pronounce his name. And really here is really to do a comprehensive data visualization to assess as whether or not there are racial inequality in exposure of air pollution. And actually what we have found that is extremely concerning, that although levels of air pollution has been going down over time, the inequalities in the exposure to air pollution are actually increasing in the United States. So I'm going to show you with a couple of visualization, actually, if you, the preprint, and hopefully when it will be published as a really cool visualization. But basically, this is a plot that we all know. And basically what this is showing is, if you could look at the levels of air pollution in the year 2000 and the level of pollution in the year 2016, clearly the level of pollution in the country have been going down. So we have that the population weighted average of PM2.5 has decreased by 43% from the year 2000 to 2016. So this is definitely a very good news. But what is not happening, and I'll spend a little bit of time to explaining you this figure, is that not everyone have been benefiting of improved regulation. So first of all, if you focus for a moment only on the map on the top and bottom left. So the only colored zip codes are for the zip codes that have a level of PM2.5 higher than 8 microgram per cubic meter. So, you know, these are the ones, let's say, that have high pollution level, you know, calibrated for PM2.5. So in this map, if you take the map that is top left, what this map is saying is in the year 2010, approximately half of the country still have a level of fine particulate matter that were high, you know, higher than 8. It's both this part and also California, right? Then the color code of the dots tell you where the Black Americans in the US live. So in the blue areas, which is the South, these are where all of the, you know, there is a higher percentage of people that are Black living in the US, okay? So in the year 2000, we have that approximately half of the country is above 8 plus California, And then you see that among people that live in areas that are above 8, approximately half are in the areas where Black lives, and approximately are in the area where, let's say, white lives, okay? Now, what's concerning is that when you go into the year 2016, and you see the map on the bottom, now, clearly you have less number of zip code that are above 8, right? Because as I show you in the previous figure, levels of pollution have been going down. So that's good. But what's really concerning that you see that in 2016, the only area they are polluted are the blue areas, are the area where the Black American lives. So basically what this is saying is that we have been cleaning up only in the white areas, not in the Black areas. And then this is exactly the same figures, but it's just showing for the white, for the white population. So basically what this is saying that what this picture shows is the blue line, it tells you over the years, the population that lives in higher level of pollution. And clearly, as I said, the number of people overall that breathe high pollution levels has been decreasing over time. But the bars, the blue bars and the green bars, it measures the amount of inequality in breathing pollution across racial groups. And so unfortunately, although pollution has been going down, the level of inequality is increasing. So then this led to COVID. We started an investigation on COVID, also led by my PhD student, Jiawu, and a faculty member in the department, Rachel Nethery. And the idea was really to assess whether or not geographical areas that have higher level of PM2.5 historically also have a higher mortality rate for COVID-19. You know, we jumped on this opportunity because, as you see from my previous slide, we have been investigating relationship between air pollution and mortality. And so we have all of their pollution data and the socioeconomic data. And so we could easily augment that with the COVID-19 data. Also, 2 years ago, a former PhD student in the department, Jonggu Ri, she wrote a paper, we published a paper, this was before COVID, that actually shows there was a relationship between historical exposure to fine particulate matter and acute respiratory distress syndrome. And many of you know that acute respiratory distress syndrome is indeed a major cause of death for COVID-19. So this really made us to think that historical exposure of PM2.5 could be a major factor in increasing the susceptibility and vulnerability to COVID-19. So we know, as I explained to you before, that we have a tremendous amount of evidence that PM2.5 has a adverse health outcome and is also adversely affecting all of the organs that are also attacked by COVID-19. So, so basically, although the epidemiology of COVID-19 is still evolving, we have thought that there is a large overlap between causes of deaths for COVID-19 and the diseases that are affected by long-term exposure to fine particulate matter. And so we hypothesized that because long-term exposure to PM2.5 adversely affect the respiratory symptom, the respiratory and the cardiovascular system, it could also exacerbate the severity of COVID-19 symptoms and therefore could increase the risk of death for COVID-19. So we have their pollution data, and then we were able to download or continue to download county level number of deaths for COVID-19 in the United States. They are available daily. And so the COVID-19 deaths are from the Johns Hopkins University Center. And then the long-term average PM2.5, we have it from our previous study. And then we appended all kinds of additional information that will be as a potential confounder, so both in terms of access to healthcare, stage of the epidemics, socioeconomic status, behavioral factor, and weather factor. The statistical model, also I should say, I don't have a slide, but the statistical model for this was pretty straightforward. It was a random effect model for negative binomial counts. We had the random effect because we account for a random specific intercept, accounting for the fact that the counties were nested within the states. PM2.5 was the key variable, and then we adjusted for over 20 potential confounding factors. So the code and the data are publicly available. And so what we found is that if you compare two counties that were adjusted by all the potential confounder, a county that has just 1 unit higher level of fine particulate matter have an 11% increase in mortality risk for COVID-19. This is a figure that we are continuing to provide, and basically what it does is estimate the mortality rate ratio for COVID-19 as more data accumulates. So we had the first preprint that was at the end of March, and then we had the second preprint in April. And so we are now at the final stage of publishing the work. But it was important that to continue to rerun the analysis as we are accumulating, unfortunately, as we are accumulating more COVID-19 data. The other interesting thing that in addition of PM2.5 being an important factor in increasing the mortality risk for COVID-19, clearly we have, again, that the area that have a higher percentage of Black have a statistically significant higher rate for COVID-19. Clearly also there was a protective effect for the more younger area. Clearly there was a positive effect for the median house value and so on. But it was striking that there was a 49% increase in COVID-19 mortality rate associated only with an increase in one standard deviation, so only per increase of 14% increase in the percentage Black in the county. Now, I think that I want to spend the last part of my talk to really think about all of the challenges. There are challenges, data science challenges with observational data, and these challenges are even bigger when you're dealing with COVID-19 data. And clearly, when you're dealing with observational data, but especially when you're dealing with the pandemic data, everything is out of control, right? Data are observational, there is an inaccuracy, it's very hard to find a control group. So there are a lot of unresolved data science challenges with this type of research. I think that they fall in three different buckets. One is how you quantify uncertainty on the different parts of analysis, how you propagate the uncertainty. Second of all is how you assess causality. Also, for example, how you deal with unmeasured confounding, and also how you ensure reproducibility of your results. And so I just want to mention and show you one picture of a work that is collated by Marianti, a colleague of mine, and she's a faculty at Columbia University. And really the idea is every time we are talking about exposure to air pollution and health outcome, the exposure of air pollution is estimated, actually is now the output of machine learning model, and therefore there is uncertainty associated with that. So they map on the left on the estimated level of fine particulate matter in the Boston area. So you see levels are higher, closer to the metropolitan area of Boston. But the map on the right is also tell you how much uncertain we are about this level. And so in some areas where we have low statistical uncertainty, but in other areas we have much higher statistical uncertainty. So how you quantify the uncertainty from output of machine learning model and then propagate the uncertainty into epidemiological models of health effect is still, I think, a very prominent and open area of research. The second one is, as I said, how we assess causality. And I think that we have been trying to follow the principle of the potential outcome framework of Rubin, but I think that in the COVID area, especially how being extremely rigorous in terms of what are the exposure levels you're comparing, what's the causal effect of interest, what's the counterfactual, what's the adequate control group, and so on. And so I think these are all the rigor of causal inference, and especially in the context of COVID-19 data, it's extremely important. And then I think, this is something I was very proud. I'm very proud of the COVID-19 work that even we came up with a preprint, and clearly these are very preliminary results, and with a lot of limitation because these are an ecological regression analysis. We documented everything, and we posted data and code available, and actually has been, I would say, really flattering that there have been studies similar to ours all around the world. We just posted a preprint of a literature review, and there are over 29 epidemiological studies now around the world on air pollution and severity and COVID-19 deaths. Clearly, as we rigor in data science does affect policy. I think, even though we're living in a very dramatic situation right now, I was pleased, as we wrote in this piece of science, that we pushed for increased scientific rigor. And so they actually, the EPA and the EPA administrator reconvened the right scientists to evaluate evidence to inform regulatory policy. So clearly, I hope that this talk, I'm giving you some interest in getting involved in the research area. We are really busy. I have a very large working group of student and postdoctoral fellow working on COVID-19 and environmental factors. And this is the general team at the School of Public Health that have been contributing enormously to all of the research that I have presented. And I think this was mostly for Harvard crowd specifically. So I'm gonna stop here, and I would be delighted to take any question that you might have.
Francesca, thank you very much for the great talk. We usually take questions from the chat, so it might be that we wait 1 minute to get a few questions popping up. But in the meantime, can you actually comment a little bit on how you are actually seeing the work of statisticians during this pandemic? And I like very much when you're mentioning that all your code is available when there is process data and everything. And at least here, I am still seeing some refusal from researchers on sharing details on what they are doing, probably a little bit afraid of being scooped. Can you comment a little bit on that?
Yeah, no, I think this is, it's a really important point. It is challenging. I think that in general, even before the pandemic, sharing data in code before the paper is published it's a very difficult decision, because in one hand, it's the right thing to do because you want to promote reproducible research. On the other hand, it's a very risky thing to do because number one is you can be scoped, and number two, the reality is with the pandemic, and this is very unfortunate, there is a race among academics to publish. So I don't have the answer for you, except to say that has been very challenging for me to figure out what's the right thing to do. To me, I could justify internally or why we were calling the New York Times even though the paper wasn't published, because I put everything out there to be scrutinized, right? So I figure, because in any other circumstances, I would have not posted the paper on a preprint, or talking to the press before the paper was published. And so I kind of like let myself do that, because we made all our analysis reproducible. And then in retrospect, I was really pleased I've done that, because then many other people could start working on this topic even before the paper was published. I mean, I hope that the paper, finger crossed, will be, we are at the last stage of review. So if you think about, we posted the paper now in April, and so we are in August. I think that even if it gets accepted, maybe in 5 weeks, I mean, I'm seeing the paper likely will be up in December. So it would have been another almost a year before everybody could have done the analysis. So I'm happy with what I've done, but I can see why people are, not convinced that sharing the data and the code before publishing is the right thing to do. For sure, I think that's something that has to be done after publication. So I know it was a long answer, probably not even an answer, but it's a tricky situation.
Definitely. In addition to that, do you have actually any suggestions? We have a few young statisticians here, and what I have been seeing in the past few years really is a big discussion here in Brazil in terms of how do you measure the productivity of statisticians today, given that the scenario that every now and again we see here is that applied papers are not well seen within the community. How can we actually move towards something more integrated with data science in general within the scope of statistics?
Yeah, no, this is another very important question. I mean, I think that, one tendency I'm seeing in the United States, and it is my hope that is happening in Brazil and for sure in data science, is that what it matters the most in terms of career advancement is the impact of the work. So doing data science research that makes a difference. And so I do think, and I would encourage, so at first in general, journals in data science, we have launched the Harvard Data Science Review, but also other more traditional applied statistics journal, they are now publishing more work on applied statistics. So I would say that, first of all, as a young statistician, it's really important that you follow your passion and what you like to do. If you like to work on theoretical development of estimator, I think it will be a mistake to not to do that, because you have to do data science. On the other hand, if you are really passionate about doing data analysis and combining heterogeneous source of data and develop methodology to change the world, then I think you should pursue that passion, even though, there might be still a culture that value more only theoretical development. I think that the work that the culture that valued theoretical development only exclusively, I think is dying out. I think we are transitioning this new era of data science. So if you want to embrace and get involved in data science because that's what you like to do, I think you should.
We have one question coming from Lorena Barberia. She thanks you for the talk, an interesting presentation and research, and she's interested in understanding the gains from different methodological approaches. On one hand, research on COVID has reached temporal and spatial dependent component, but on the other hand, there are gains in focusing on the identification and causal inference. Can you talk about the methodological challenges and why you chose the emphasis on causal inference here?
Yeah, sure. I mean, excellent question. And I think this is why when you are really getting into data science, I think the most important thing that you start your investigation is what is the research question that you are interested, right? So you are absolutely right, Lorena, that actually, once again, the COVID-19 with all of the crisis is also provides an enormous amount of opportunity for research. That particular paper, I had a laser focused interest in knowing or advancing our understanding as whether or not exposure to fine particulate matter were increasing the mortality risk for COVID. And so because that was the question I was interested, and because I knew that the biggest challenge, which still remain into assessing this causal effect, this confounding, I wanted to do the best I can and try to understand methods for causal inference and developing methods for causal inference for looking at the relationship between exposure to fine particulate matter and health outcome and generally COVID-19 mortality rate. Now, this is one, as you know, of hundreds and thousands of important questions that we need to address using data science in COVID-19. So, for example, if you are wanting to understand the impact of different intervention, whatever is a lockdown or closing restaurants or closing school, on the spatial temporal component and how COVID spread, that's really very different statistical approaches that you can take. And so I think that I feel that also this is what, going back to the previous question, data science to me is really starting from the question and then developing the methodology and acknowledging the complexity of the data to address the question that you have formulated in the best possible way, given the data that you have, which is different from wanting to develop methodology that is not directly aimed at addressing a specific question.
Perfect. I was actually, this is a curiosity of mine. Is there anything that you could comment on the data science initiative there at Harvard?
Yes.
What is it and how is it working?
Yes, sure. So Harvard, is huge, has 9 different schools, and it's highly decentralized. And a few years ago, when this new era of data science, started to emerge, there was a lot of confusion about what's data science. Is it data science statistics? Is it data science and biostatistics? Is it data science informatics? And so basically we were, our data science initiative is called an interfaculty initiative. So it doesn't belong to any school or to any department, is interfaculty. So if you are a data scientist, wherever you are doing data science in humanities, so for example, there are people that are doing machine learning to recognize different images in the arts, people that are doing machine learning to classify songs, anything you do that is related to data and data science. So we are trying to create a new connection. We are revising the curriculum. We have different masters in data science. We are connecting students across the different disciplines. And so we are giving grants. We have I wanted to say that this is something important for you all to know. We have a very prestigious program for, we call it the Harvard Data Science Postdoctoral Fellows. We recruit 3 to 5 fellows in data science every year. Generally, the call is published sometime in September or October. So we'll love to get application from people from Brazil. We want to be very international. If you look at the website, We actually, some of our fellows, we had fellows from Chile, we have a fellow from Spain, we have a fellow from the UK. So it's absolutely very, very international. So we do all kinds of activity to advance the field of data science and to connect faculty and students across the university that want to do data science.
That's actually very interesting, because what I've seen here is that there is always this, I don't know if I could call it a fight, but there is some sort of dispute between institutes or departments, schools, on who is the one who is going to host a data science program here. And this approach for me seems to be very appropriate, because it's actually a very interdisciplinary area, right?
Yeah, I mean, you know, don't get me wrong. There was a fight here as well that lasted for, you know, 2 years, but then eventually everyone agreed that. And the bottom line, to be honest with you, is there is, I think the good news is that I feel that data science is actually kind of the grandmother of all of the other disciplines, right? Whatever you are, if you are a statistician, a biostatistician, you're doing health informatics, you are doing computer science, right? There are, the reality is, and I think actually try to address data science question with COVID-19, it's a perfect example of why you need expertise across all of the area. Even this simple project that we have done on exposure to fine particulate matter in COVID-19 was possible because we rely on expertise in computer scientists that were able to scrape data on daily numbers of deaths across the United States and put it in a continuous database, and also computer scientists that estimate exposure to fine particulate matter using machine learning model. I am a statistician, and so we analyze the relationship using methods for causal inference, actually a biostatistician to be more concrete. And so, and we had a lot of epidemiologic expertise. So I don't think that, you know, again, it's a field that belongs to a specific department, but it's actually a field that can bring the departments together. And the reality is, as you're seeing with really the most complex problem that's affecting our society, whether it's a pandemic, whether it's environmental racism, whether it's climate change, you need all of this expertise together to address the question. And if you have a methodological statistician working in isolation, or an applied statistician working in isolation, or a computer scientist working in isolation, I'm actually pretty confident to say that would be much harder to have an impactful work, right? Can you publish the single paper? Yes. Can you gonna change the status quo? Probably not.
True, very true. Francesca, I think we are getting to an end here. Thank you very much for your participation today and accepting our invitation. I think this was really enlightening. I've got a few private messages with people saying that they're going to be in touch. Apparently, your advertisement on the data science postdoctoral program is already hitting some names here. But thank you very, very much for your time and for your talk.
You're welcome. Thank you very much for having me. Be all safe and good.
You too. Take care. Thank you.
Bye.
Bye.